Hello again and welcome back to 90 Day Dental Day 42. So we're really plowing through the series now and we're on day 2 of Endo with Massimo, and today specifically we're going to be talking about perforations and MTA, which is a really important and relevant topic for a lot of us. Take it away again, Massimo.
Hi, my name is Massimo Giovarruscio, Stile Italiano Endodontic Gold member and co-owner of Dental Academy based in Bristol. Today my topic is around the perforation of the teeth using some bioceramic material that we have nowadays available. So my aim is to deliver to you which are the tips and tricks to solve this problem that can happen to everyone. Remember that if we don't try to do something, we can improve what we do, and that everyone can get a mistake, but the best thing to do is to have something in the drawer to use and repair something that we are going in our teeth. Do you know that MTA went out in 1993, so 27 years ago? And after that one we have many articles that come to the market about almost 2000 scientific article, 90 review. So I would say that MTA is now material that we can be discussed because it's very approved over the world. Of course, during the time from 93 up to today, 2020, we have many products come to the market, and now all this material has been called like bioceramic. You know that the MTA give us some disadvantages, like setting time. The MTA is difficult to manipulate, so it's difficult to deliver in our teeth, and then is of course very hard to apply in a narrow canal, and then when we use it, because it's a strong material, it's like a concrete material, it's difficult to retreat these teeth. So some disadvantage. This is why in the generation about MTA we have many categories. We have now in 2020 talking about the third generation that we are using bioceramic material. So bioceramic material are material base of MTA but updated. This is the composition of the material. You can see that the first generation, we're talking about 1993, we have Portland cement, and then we have some radiopaque material, and then water. So addition the water. Nowadays, if you're talking about bioceramic, we have the tricalcium silicate, additives, and some vehicle or premixed material like resin. But the clinical uses of MTA are various. To crown to the apex, we can use from pulp capping up to root canal surgery. So there are many options. Today I want to talking about root floor perforation that can happen to everyone. Very easy. I wanted to just talk to you about this calcium silicate. So this bioceramic material that come through in the market recently is we call Endopass from Professor Salvatore Sauro. I've been collaborated with him and we study about this new calcium silicate material that is very nice. This because respect to the MTA, the classic MTA set very quick. We can wait 5-6 minutes, and then we have a setting of the material, not total setting, but it's a setting enough to proceed with direct restoration or composite restoration. Of course, the other point is that we can also use a self-etch adhesive material to restore immediately. So we don't need to wait actually 24 or 48 hours before restore the tooth. So with this kind of new material, we can restore immediately. But using is very important self-etch adhesive, because you know that we can't use etching over bioceramic material and of course MTA material. On the market we have many self-etching adhesive, so you can use whatever you like. I'm using new extra bond material because these materials come from Salvatore South as well, so it's a combination with Endopass and then new extra bond material because it's studied properly for this purpose. And again, I want to give you some advice, tips and tricks to how to mix the MTA or bioceramic. Normally dentists using a glass pad. I suggest to use a rubber pad that you can see on the right of the screen because it's much easier. It's much easier to mix. So we can have like power with the liquid, the composition of 1, 2, 3. So you can mix all together. You can see the quality of mixing. You can add water as much as you like. It's important to have the final result like a cream. As soon as you get the cream, that is much easier to get them with the rubber material. You can use some stuff to deliver that. So in that case, usually I'm going to use a MAP system. The MAP system is like a syringe, though you can collect the MTA and then deliver in the cavity. You can see this is the nurse job, so you can help you. You see this is the plug that able to make, so it's very long. So we have a length 5mm, gauge 80, so it's very big. Sometimes we see that if in case it start to setting, like in this case, we can reuse, so the nurse can add the liquid, so to reactivate the hydration process, so you can reuse it what seems to be dry. So this is very versatile material, so we can use in easy manner, and then again when you get the cream consistency, you can deliver again and then you can use it. You can use this stuff, maybe it's cheaper, so a little gun with a syringe, the orange one, so you can deliver inside and you can have the same effect. So the difference is that of course this kind one you can find everywhere and is very cheap. Apart of this, you can use this stuff that you can put inside in this delivery. So this is of course a nurse job, and then with the plugger you can take this and deliver. Very easy, very cheap if you don't have the MAP system, and then you can use this in retro cavity. The other tip and tricks that we can use this one, if you have a plastic box that we normally use for endodontic training in the academy, you can make this one with your burrs, so you can customize as much as you like, and then after that you can give like a little slots that the nurse fill up with MTA or bioceramic, and then you can deliver, you can use it and deliver as well in the canal using the plugger. So very easy, very nice. What about the perforation? Repair perforation in the forecalf or in the floor of the tooth. It's important to check if the perforation is fresh. Fresh perforation, that means that should be done within a year. So in that case, the results are very high. I want to show you what we are using in a Style Italian Endodontics recipe when we repair the floor perforation. The system that we are going to use is like a MAP system. Of course, Endopass, like bioceramic material. We can use a little micro brush, sponge in case we have a big perforation, and then some plugger to help and then to compact the material. This is a case that we can appreciate the perforation in the chamber because bidimensional images doesn't give us the idea about the perforation. Maybe the CT scan can help in a bit, but obviously the clinical situation gives us the idea about the perforation. Large perforation in the floor. This is what you can see is a microsuction. So you can see how removing the suction in the perforation, we can appreciate the presence of the bone. In that case, because we have a large cavity in the furcation, we want to place some sponge just to protect, to avoid that the MTA or bioceramic goes everywhere. I like to clean the perforation because I treat the perforation as in a cavity. It's full of bacteria. After that, when it's ready, I place my fibrin, in my collagen barrier in the furcation, and then after that I can use a bioceramic. In this case, the Biodenti has been used. Very nice material, I love it. You can use anyway. Bioceramic in this case, you know, that set very quick, 5 minutes. Is a part of the Biodenti, is a second generation bioceramic, very good material. And then I deliver the material using the syringe, the orange one, and then we can deliver. And then you see that after 5 minutes setting, I'm just going to check where is the distal buccal and mesial buccal in the other part of the tooth. When the canal has been found, of course, the root canal has been done. Sometimes, to avoid that additional bioceramic can get and obturate the canal, is better to protect with the GP. So using just a guttapercha point just to protect this, so you can build up your floor and wait the setting. Very clean, ready to be restored in one visit using self-adhesive material. We don't need to etch, so you can use GIC, you can use a composite material, whatever you like. In that case, I prefer to use GIC, especially in using bioceramic, because of the acidity, the pH of GIC is not very low. And then this is the final one, so you can appreciate the root canal and then restoration with GIC and that. Another procedure for the using calcium silicate we call a laminate technique. This is a floor perforation that you can appreciate properly using the CT scan. You can see how large is the perforation. Of course, the clinical view make a difference, so you can see the removing this. I call this procedure like MTA sandwich technique, because I make like a sandwich reparation of the perforation. After removing the temporary, you can appreciate the perforation in the chamber, but even better if we can check in the canal. So we have a mesial buccal and mesiolingual. You can appreciate the canal, and then if you start to clean and proper, you can just try to looking for the root canal system. It's very important, because if you know where the canal are, it's much easier to understand if you can prepare the perforation. In that case, you can appreciate the sides of the perforation close to the mesiobuccal canal. In that case, you can start to clean using, of course, magnification. You can use loops with light, even microscope, and then because the cavity is clean or cleaner, you can appreciate mesiolingual and mesiobuccal. The other point is that I want to looking for the mesiobuccal canal, because I want to protect it. Otherwise, I can't restore, I can't repair the tooth using bioceramic material. In that case, just a pre-flaring of the mesiobuccal canal give me the possibility to isolate the mesiobuccal canal. In that case, I want to protect the canal, mesiolingual and mesiobuccal, using a guttapercha point. So I place them there, and then I'm able to repair, I'm able to build up using bioceramic. And there you go. GP point in the canal, mesiobuccal, mesiolingual, very clean, not bleeding, very important. If it start to bleeding, you need to wait maybe a week time with the calcium hydroxide. And after that, you are able to build up easily like a direct composite cavity material. You can fill up with MTA, bioceramic, everywhere. And then in that case, I have to wait 20, 24, 48 hours. Just is the check about my repairing. So after a couple of days, we are ready to restore. The patient comes back, removing the temporary, check the setting of the material, and now it becomes very easy to perform the root canal system. And then after that, we are ready to restore, remember, using self-etch adhesive and then GIC, if you like. This is the final result with a 6 months review, so it's going very well, nice result. The permanent crown has been fitted by the referral dentist, so no symptoms, patient is empty, absolutely empty. And I want to underline that in our course in Dental Academy, we use Mythica, so the delegates are able to practice in this amazing possibility. There are 3D teeth, so you can practice at our course using apical plug, pulp capping, full perforation, apical surgery, so you can learn and practice on the teeth using the latest technique and then the latest bioceramic material. So thank you very much for listening, and see you soon. The next webinar talking about one of my favorite topics, which is the restoration of endodontical 3D teeth. Thank you very much. See you then. By Massimo Giovarruscio. Bye.
So more than halfway through this particular topic, and we've got one final series to go tomorrow. See you again then.